Just look at the camera, or look at me, whichever way. We are live from the State Health Operations Center in Smyrna, Delaware. And this morning we're joined by Dr. Karyl Rattay, the Director of the Delaware Division of Public Health. And we're also joined by Dr. Morrison, who is the President and CEO of Brandywine Counseling. Good morning.
Good morning. So thank you all for joining us today. As you know, we continue to provide Facebook Live updates weekly, including some time to answer your questions. So let me first update you with the number of cases. As of the end of day yesterday, we had 104 positive cases in Delaware, 71 from Newcastle County, 10 from Kent, and 23 from Sussex. And unfortunately, 11 people are hospitalized statewide, including 5 in critical condition. Our age range now goes from age 1, so we do have a 1-year-old child who is the positive case, all the way up near age 90. So we now have a large age range of individuals impacted. So since we last met a week ago, a lot has changed. Governor Carney updated his state of emergency declaration, ordering Delawareans to stay home as much as humanly possible, closing all but essential businesses in the state to help decrease the spread of COVID-19. The governor also declared a public health emergency, and part of this helps strengthen our workforce, which enables either recently retired health providers or those who are licensed in other states to be able to work in our state. We also have been working with hospitals across the state to stand up a statewide testing system, which officially began on Monday, so that Delawareans who are in need of testing have access to testing. And when I say in need of testing, that means people with symptoms of coronavirus. The first thing people should do if they think that they should be tested is call your provider, talk to your provider, and through this new testing system, your provider can write an order to go to one of the testing sites for you to get tested. So a lot of things have changed in the last week, and I think it's challenging in many ways, but really, really important for people to be doing everything they can to stay away from other people, and very importantly, stay home when you're sick. We're going to talk more about that, but you're probably going to hear me emphasize this over and over again, because as we look at our cases, we're seeing a lot of people who aren't abiding by that. And we have to do all that we can as a human race, as a group of Delawareans, to help support each other in making the right decisions. That means if you are at all ill, and we've been talking a lot about fever, cough, and shortness of breath, but when we look at our cases now, we're seeing a lot of people whose illness starts with muscle soreness or even sore throat. If you have any signs of illness, including even diarrhea, don't leave your home. Please don't leave your home, and please do not go to work. Don't go to the supermarket. Have somebody else get your groceries for you. I just can't emphasize that enough. And additionally, now that we have community spread, we know we have COVID around the state, we all have to act as though we have the virus, and we have to act as if everyone else has the virus. And that means we need to stay at least 6 feet away from everyone else. So this is stressful, right? It's really stressful. It's stressful for those who are in their own homes. It's stressful for those who are watching the media every day and worried about what's going to happen to them and their loved ones. And so we're really, really grateful to have Dr. Lynn Morrison here from Brandywine Counseling to talk with us a little bit about the mental health impacts, what you're seeing, and also what guidance you have for Delawareans.
Great. Good morning, everyone. I think we're all adjusting to this new reality of living in a world of a world pandemic, right? We're adapting to the social isolation or social distancing, and it's difficult, but we know, and I think we've heard how important that is. And by doing that, we have to remember that we're doing something good. So as difficult as it might be to have that social distancing or isolation, we need to remember that we're actually doing a really good thing for the people we care about, who we love, our community, and the world, really. That we need to recognize that a lot of people are starting to recognize the fear and the anxiety that's getting created by all the media, the constant information coming in, and the changing, right? This is a fast-paced, changing thing that we all are trying to keep up with. I think it's really important that we talk about how do you take care of yourself in this environment, right? So at Brandywine, we have about 6,000 clients who are in recovery. Everybody's at different phases of that recovery. And so there is some general messaging that we're giving to everyone. One as simple as staying as positive as you possibly can. The Brandywine staff are doing that, and we're trying to encourage everyone we come in contact with. This is not forever, right? This will be different eventually. So just be positive. The important that we understand the distinction between social isolation and social distancing, right? We don't want anybody to feel isolated. So we want to try and stay as connected as we can. And again, in this environment, that's really looking more like Skype, texting, emailing, Facebook for our generation. I think the younger kids are doing the Snapchat. So, using those tools to stay as connected as possible. Yeah. We're also encouraging people to find small goals that they can accomplish, right? So when us as humans can cross something off our list, it gives us a good feeling. So is it a book that you've been meaning to read? Is it cleaning a closet that you have to clean, been putting it off? And it could be something big. It could be learning a new language. So everybody has to kind of find that something for themselves. So these simple things. The other thing I really want to encourage people to do is start meditating, right? That overall sense of well-being is really important. And meditation has been researched to show that can happen. And again, that's just deep breathing. If your mind's racing, it's okay. Just sit in a quiet space, do the deep breathing, and encourage your family to do that. We're all some of us are in tight environments, spending a lot of time with family that we're not used to doing. And some of that is trying to create a schedule. Families can attempt to create a schedule that they have every day that if they're in that environment. And of course, planning fun, right? Is that board games that people don't get an opportunity to play, and recipes that you've been meaning to try. Again, if you're not feeling well, do not go to the grocery store, put it off. So, there's no one remedy, tried and true, exercise, getting moving. And that can be walking around your house. If you're going to go outside, I think we're still allowed to do that. But again, you need to maintain the social distancing while you're doing it. You can talk to your neighbor from a distance. It's okay. And you can find things in your own house, gallons of milk, and do curls, right? Time to get creative. What can you do just to keep your heart rate up, moving, and exercise? That has also been known to help people's overall well-being. Depression can sneak up on you, right? So I think another thing that we tell people is it's so important to stay connected. Friends, families, doctors, counselors, telehealth. A lot of the behavioral health providers are doing telehealth, and we're finding that people like it. right? Don't be afraid of it. People are still finding that they can connect to the provider through that telehealth. We've also, in Delaware, have some excellent resources, right? So Brandywine's website is one place we can go, but Help is Here, de.com, highly recommend it, as well as what public health has been doing for us, the call-in centers for all Delawareans to access, and keeping up to date with fact-based information, which is so important, and what you're going to get here with you. So I think, that is kind of in general what we're trying to help people to do. And remember, I know we're all hearing this a lot, and it might sound a little cliche, but we are all in this together. And we all have a part to play. And that, again, remember that, stay connected.
Yeah, that's all great advice, Lynn. And, one thing I've seen people doing, and I've been on the receiving line and the receiving end, and as well as I hope enough on the administering end, is thanking people. There's a lot of people out there who are, especially, healthcare providers, people in the healthcare workforce, but many others doing essential services, that thanking them for what they're doing can make you feel good.
Yes.
Just to really show that appreciation. I think your advice around meditation is great. A lot of people aren't really familiar with how do you do that? How do you even get started? Some people have tried here and there and are like, oh, I can't do it. Do you have any advice around that?
Yeah, I think that we need to be gentle with ourselves, right? Being kind with ourselves and others. And in meditation, that's really important because it's not easy. And a lot of people give up because they don't think they're doing it right. So you do a couple of minutes and build yourself up, right? You don't have to do 20 minutes right away. Mm-hmm. So 5 minutes, again, focusing on breath. So you want to count in, taking a deep breath, filling the belly up into the chest, holding it, and then releasing. Mm-hmm. I use the Hail Mary to do mine. So the breathing in is the first part of the prayer, and the breathing out is the second half. So some people just count. So find something that works for you, because my brain does not stay calm. And then I forgive myself, and I just keep pulling it back to in the moment. Yeah. And practice. You have to do it every day. Some people do it twice a day. And again, you don't have to do long periods of time.
Yeah, that's great advice. And I think one thing you just said that's important is none of us are perfect, right? So we might find that the time we spend, confined in our homes with our children or our families might be hard, and so you might end up raising your voice, or and we have to be kind to one another and recognize it's a stressful situation.
Yeah.
Take some time out, do some deep breathing in a quiet space, and
Yeah.
Yeah.
Taking time for yourself, trying to find time for yourself in the midst of caring for your family if you're in a family unit situation. Absolutely.
That's great.
Dr. Rattay, we didn't get a lot of questions, but one of them comes from Gunmala Shingavi, and they ask, how should we keep social distancing in our homes even? If somebody's a healthcare worker maybe, or there's some recommendations you have for how people can ensure that their families and they are safe. Yeah,
so, in your own home, it's a little bit more of a controlled environment, right? In that who has symptoms and who doesn't, and so I'm not saying you should be, snuggling up together as a family, but the 6 feet apart, you can kind of loosen your mindset a little bit in your home with your immediate family. If nobody is ill at all, certainly have dinner together at the dinner table. But of course, then do everything you can to monitor everybody's symptoms, and also, keep surfaces clean, and hand hygiene. All of that in the home is really important. Now, healthcare providers, and this is something that we've been trying to emphasize, but I'm realizing we need to spend more time making sure that, number one, as Lynn was mentioning, if you are ill, first call your provider. So we really are trying to really whether it's telephone conversations or telemedicine, keeping ill people out of the healthcare setting is really important right now, which is, you usually think the healthcare setting is to help support sick people, right? But we need to keep our healthcare providers from getting sick. If you have those symptoms and you are coming in, that really helps for the healthcare providers to know that, because they can protect themselves, right, with the appropriate personal equipment. But if they don't know you're sick, if they don't know you have these symptoms, then you're putting them at risk if you expose them.
And one other question we received is from Michelle, who asked, is there a good way to explain to children about the coronavirus? Do you have any kind of advice for how people could talk to their kids and, maintain some good dialogue with them?
Yeah. Do you want to go first?
Sure. It's important in times like with any difficult conversation with a child is to let them take the lead. Basically open up a conversation around, are you hearing, I know you're home from school, do you understand why? And try and elicit what information they have. And then you can help clarify and ask them if they have any additional questions. You really want to measure what they're ready for and not overwhelm them with too much information, but make sure that they have the facts. And know that as long as we all do what we need to do, we're going to be okay. But we need to abide by what the officials are telling us to do.
Yeah, I think that's really great advice. It is important to be truthful, but it depends, of course, on the age of the child, how much we discuss. My kids are ages 12 and 15, so we are having open conversations. And I'm also learning a lot about what they're hearing on social media, which is not true, some of it. And so I think it's also important to ask them, what are they hearing? What are they hearing from friends and from, from Instagram, to help them understand the facts.
Absolutely.
And if people have any questions, is there, a recourse for them? What is the way that you recommend that they can get more information, both about coronavirus, or if they may need any additional assistance with some counseling or somebody to speak with?
So as it relates to coronavirus, our call line, which is 1-866-408-1899, is a great place to call to talk about coronavirus. We also have an email, dphcall at Delaware.gov, sorry. And there's also our de.gov/coronavirus website. So we're trying to get as much information out there as possible. Centers for Disease Control and Prevention also has some really good information out there for public. So, those are two, really fact-based places. I'm going to let Lynn answer about where to go for counseling or information around mental health.
Right. So one of the first places we encourage people to follow their insurance. Go check your insurance, see what your insurance is covering. Again, all the behavioral health organizations that I've come in contact with are moving to telehealth, so they should all still be available through telehealth. If insurance or you want to know in general in Delaware, again, help is here, de.gov. And then again, for specific agencies like Brandywine, you can get it from our website.
Great. Thank you very much, Dr. Rattay and Dr. Morrison, for your time from the State Health Operations Center in Smyrna, Delaware.